Good evening, students. Good evening, everyone. Today we'll be discussing about the premolars, the comparative anatomy of the premolars, right? So, today's discussion would be on the premolars, their comparative anatomy, right? And just like yesterday's class where we discussed the comparative anatomy of anteriors, we'll begin with the lobes, their developmental center. The lobes are the developmental centers, isn't it, of the tooth. So, as I've told you yesterday as well, that at least 4 lobes are required to form any tooth, isn't it? At least 4 lobes are required to form any tooth. And same is the case for premolars. At least 4 lobes are required to form any premolar. And here, as you can see in this diagram, I have marked these lobes with different colors, right? So, as you can see, the facial surface or the buccal surface is made up of 3 lobes, isn't it? A mesial lobe, a distal lobe, and a middle lobe, right? So for any premolar, you can see that they are made up of at least 4 lobes, of which 3 are buccal and a single lingual, or you can say palatal lobe, right? The exception is mandibular second premolar, right? The exception is mandibular second premolar. So in the mandibular second premolar, the tooth which has 5 cusps, the 5 cusp type, right? The mandibular second premolar, it has the most variable anatomy amongst all the premolars. So the mandibular second premolar, it has 2 variants, a 2 cusp type and a 2 cusp type and a 3 cusp type. It's not 5 cusp type, right? So it's either 2 cusp type or 3 cusp type, and 3 cusp type is more commonly seen. This 3 cusp type variant is more commonly seen. So in this variant, in the 3 cusp type variant, we will have 2 lingual cusps and a single buccal cusp, right? So this is the more common variant. A lesser common variant is 2 cusp type. The 2 cusp type second premolar would be made from 4 lobes, but this 3 cusp type is made up of 5 lobes. Same as other premolars, 3 lobes will make the buccal surface, and the lingual cusps are individually made up of single lobes, right? So there are 2 lingual cusps, mesolingual and a distal lingual. So both cusps are made up of single lobes, right? So this was about the lobes. So apart from mandibular second premolar, which is 3 cusp type, all the premolars are made up of 4 lobes, right? So next we'll go to cusps. Next comparison would be with regards to cusp. So when we say cusp, all the premolars, as I just told you, they will have at least 2 cusps, isn't it? They will have at least 2 cusps, a buccal and a lingual. A buccal, lingual. This is the buccal, this is the lingual. Except for mandibular second premolar, which might also have 3 cusp anatomy, and which is the more common anatomy, isn't it? So except for the mandibular second premolar, all the other premolars always have 2 cusps, a buccal and a lingual. Now when you take a look at their comparative sizes, what you would notice is that in all the premolars, the buccal cusp is longer as compared to the lingual cusp, isn't it? Buccal cusp is longer than the lingual cusp, except the mandibular second premolar. In case of mandibular second premolar, the buccal and lingual cusps, they are of almost similar size, isn't it? They are of almost similar length. They are of almost similar size. So their size and their length is almost similar, right? So as far as the sizes of the cusps are concerned, you may say that the mandibular, the maxillary second premolar is the most symmetrical one, isn't it? Now, this is the tooth which has almost similar cusp. which tooth amongst these four has maximum difference between the sizes of this buccal and lingual cusp? And as you can see on the screen, it is the mandibular first premolar, where the lingual cusp can be said to be non-functional, right? So here it is so small, you can call it non-functional. You can call it non-functional. In fact, the lingual cusp of first premolar is often compared to a cingulum, right? It looks like a cingulum. It is not a cingulum, it is a cusp, but it often looks like a cingulum. So therefore, we often compare it to a cingulum, and we often say because of these features, they resemble like an anterior tooth, isn't it? So we also say that this mandibular first premolar, it resembles more like an anterior, so it may be a connecting link between the anteriors and the posteriors. This is the only cusp which is non-functional. So if someone asks you which tooth has non-functional cusp, it is the mandibular first premolar. Also, when you will notice the placement of these cusps, you would see that all the cusps are within the crown outline, right? All the cusp tips are within the crown outline. But in case of mandibular first premolar, the cusp tip of the mandibular first premolar lies outside the crown outline. The mandibular second premolar is marginally inside the crown outline, isn't it? So what it suggests is that the crown overall has a lingual tip in the mandible. In the mandible, the premolar crown, right? The premolar crown has a lingual tilt, right? ऐसा लगता है ना, इस जब आप इस टूथ को देख रहे हो, मैंडिबुलर प्रीमोलर्स को देख रहे हो, तो ऐसा लगेगा ये टूथ जो है थोड़ा सा लिंगुअली टिल्ट हुआ है. So it's not the tooth that is lingually tilted, it is the crown, right? So the crown is bent on its root. So the crown is bent on its root. Crown is bent on its root. So instead of being straight like the maxillary premolars, the mandibular premolars would appear like this. So it appears as though the crown is bent on its root, right? So that's the reason their lingual cusps are often closer to the crown outline, or they are beyond the crown outline. So in case of mandibular first premolar, the lingual cusp lies outside the crown outline. So this is the only premolar where the lingual cusp is outside the crown outline, right? So as you can see, in all the premolars, the crest of curvature means maximum convexity. The maximum convexity lies somewhere in the middle third, except in the mandibular first premolar. In the mandibular first premolar, on the lingual side, the crest of curvature is in the occlusal third, right? It is in the occlusal third. So what all differences did we notice? First of all, similar cusp size. This is only in maxillary second premolar. Maximum difference in cusp size, that is in mandibular first premolar, isn't it? The only premolar with 3 cusps is mandibular second premolar, right? Non-functional or cingulum-like cusp, lingual cusp, obviously, it is the mandibular first premolar, right? Lingual cusp tip outside crown outline, again it is for mandibular first premolar. So these are all the features as far as the cusps are concerned. These are some of the comparative points regarding these premolars, right? And also as you can notice that they appear to be lingually bent. So let's go to the next feature, which is cusp angles. So cusp angles, sometimes they might ask you which is the sharpest premolar, which premolar has the maximum cusp angle, which has the least cusp angle, right? So obviously always the first premolar is sharper as compared to the second premolar, and the maxillary premolars are sharper as compared to the mandibular premolars. So what general rule can be established? That the first premolar is sharper as compared to the second premolar, and second is that the maxillary premolars are sharper than the mandibular premolars. So if someone asks you what is the angle or the cusp angle of the maxillary first premolar or mandibular first premolar, what would you say? The maxillary first premolar has a cusp angle of 105 degrees. Mandibular first premolar is 110. Maxillary second is 120, and mandibular second is 130 degrees. So as you can notice, as far as the first premolars are concerned, the maxillary is sharper. Again, in the second premolar, the maxillaries are sharper. And amongst the first and second premolars, it is always the first premolar that is sharper, right? So first premolar is sharper than the second premolar, and maxillary premolars are sharper as compared to the mandibular premolars. So this was about the cusp angle, right? Next, let's go to the cusp ridges. So as I told you yesterday, that cusps are made up of cusp ridges, isn't it? A mesial cusp ridge and a distal cusp ridge. So let's say this is the mesial cusp ridge and this is the distal cusp ridge. Everywhere this is the distal cusp ridge, mesial, distal, mesial, right? So in all the teeth with cusps, you have two cusp ridges, a mesial and a distal cusp ridge. And as we have established yesterday, that it is the distal cusp ridge which is longer as compared to the mesial cusp ridge, right? Distal cusp ridge is longer than the mesial cusp ridge. Yesterday also I told you about two exceptions. And what are those two exceptions? Maxillary deciduous canine and maxillary first premolar. These are the only two teeth. These are the only two teeth where mesial cusp ridge is longer than the distal cusp ridge, right? So mesial cusp ridge is longer than the distal cusp ridge. This is only in the maxillary first premolar amongst these four teeth, right? So since the mesial cusp ridge is longer, the cusp tip is slightly distally deviated, isn't it? So in case of maxillary first premolar, the buccal cusp tip is distally deviated as compared to its lingual cusp and as compared to all the other premolars. So when you compare it to maxillary second mandibular premolars, you would say that the maxillary first premolar's cusp tip, it appears slightly distally deviated even compared to its own lingual cusp. It would appear slightly distally deviated. So this is the only premolar where the buccal cusp tip is distally placed, right? So this was about the marginal ridges, cusp ridges. Next is marginal ridge. Marginal ridge we have studied in anteriors as well. In the anteriors, the marginal ridge was located on the lingual surface, isn't it? So in the anteriors, the marginal ridge was located on the lingual surface. And yesterday, I think I did not mention that this marginal ridge is at an angle of 45 degrees, right? They are not horizontal or vertical, they are inclined. These marginal ridges are inclined in the anteriors and they make an angle of approximately 45 degrees. And I also told you yesterday that the mesial marginal ridge is larger or longer as compared to the distal marginal ridge. And same rule holds good for the posteriors as well, right? So even in the posteriors or in the premolars, the mesial marginal ridge is longer and larger than the distal marginal ridge, right? So mesial marginal ridge is longer and larger than the distal marginal ridge. So here in this picture, you can see the mesial marginal ridges, or you can see the mesial view of all these teeth. Another thing, in comparison to the anteriors, in the anteriors, as I just told you, that the marginal ridges are at an angle of 45 degrees. But in the posteriors, as you can notice, the marginal ridge is perpendicular to the long axis, isn't it? The marginal ridge is perpendicular to the long axis. So marginal ridge in posteriors, premolars and molars included, marginal ridge in posteriors are perpendicular to long axis of the tooth. Now, as you can see in this picture, the mesial marginal ridge of lower first premolar does not appear to be perpendicular to the long axis, isn't it? It does not look perpendicular to the long axis. So this is the only exception where the marginal ridge is not perpendicular to the long axis. Here, the marginal ridge makes an angle of 45 degrees, right? So mesial marginal ridge of mandibular first premolar makes an angle of 45 degrees to the long axis, right, or to the horizontal, whatever you want to call it, right? So this is the only exception. The another exception being, as I just told you, mesial marginal ridge is longer than the distal marginal ridge or larger than the distal marginal ridge, but in case of lower first premolar, the distal marginal ridge is longer than the mesial marginal ridge, right? Or in case of posteriors, we also say that it is higher in occlusion. The mesial marginal ridge is higher in occlusion. So what it means is that when you look at the tooth, let's say this is the tooth from the mesial view, and this is the same tooth from the distal view, right? This is the mesial view, this is the distal view. So the mesial marginal ridge is higher as compared to the distal marginal ridge. So what it means is more of occlusal surface would be visible from distal side. So more of occlusal surface is visible from the distal side in any posterior tooth because the mesial marginal ridge is higher. In case of mandibular first premolar, the mesial marginal ridge is inclined at 45 degrees and is therefore lower as compared to distal marginal ridge. And so more occlusal surface is visible from the mesial side. So this is the only posterior tooth where more occlusal surface is visible from mesial side, right? So that is another example, that is another exception. I hope this is all clear to you. If you have any doubts, you can ask me anytime, right? So this was about the marginal ridges. Apart from that, you can also notice that the marginal ridge of maxillary first premolar, right? The marginal ridge of maxillary first premolar is crossed by a groove. This is the groove, isn't it? And this is known as mesial marginal groove. This is a developmental groove, right? And this is exclusively seen on maxillary first premolar. So you can say this is a characteristic feature of maxillary first premolar, the mesial marginal groove, and from the occlusal surface, it continues on to the mesial surface, and there it continues to the concavity on the mesial surface of the crown. So there is a concavity. So there is a concavity on the mesial surface of the maxillary first premolar. Again, this concavity amongst all the premolars is seen only in this maxillary first premolar. So that is a characteristic feature. The mesial crown concavity is a characteristic feature of maxillary first premolar. So the so this mesial marginal groove, it continues to the mesial crown concavity, which further continues on to the root to the mesial depression, right? Developmental depression on the root. So mesial marginal groove continues to the mesial crown concavity, which continues on to the developmental depression on root. So let's go to the next feature, is the occlusal surface. So when we take a look at the occlusal surface, sometimes you might be asked about the shape of the occlusal surface. So how does the occlusal surface appear? So when you look at the maxillary first premolar, its angles are a bit sharp, right? Its angles, they appear to be a bit sharp, and hence its outline can be classified as hexagonal. In case of the maxillary second premolar, its angles are a bit rounded and therefore it appears oval. The mandibular first premolar almost resembles a maxillary canine, right? It resembles the maxillary canine, and its shape is almost diamond shape, right? In case of mandibular second premolar, as I've told you, it has two types of anatomies, a three cusp type and a two cusp type. Three cusp type being more common, so its occlusal surface is often classified as being square. If it is a two cusp anatomy, this is for three cusp type. So if it is a two cusp type, then again, just like the maxillary second premolar, it would also be classified as oval, right? So if it is two cusp type, it is oval. If it is three cusp type, it is square, right? So mandibular first premolar, diamond; maxillary first premolar, hexagonal; maxillary second premolar, oval; and mandibular second premolar, if it is two cusp type, oval; if it is three cusp type, then it is square shaped, right? So this was about the occlusal anatomy. Now, when you take a look at this occlusal surface of all these teeth, which of these teeth appears to be most symmetrical? Which of these teeth appears to be most symmetrical, bilaterally symmetrical? Which is most symmetrical? Which is most symmetrical amongst all these four teeth? So obviously, maxillary first premolar isn't symmetrical because it has a mesial marginal groove, which clearly differentiates its distal and mesial sides, isn't it? The mandibular first premolar also has a groove crossing on the mesial side. It's not crossing the mesial marginal ridge, but it is crossing the space between the marginal ridge and the cingulum. So it is often called mesiolingual groove. This groove is called mesiolingual groove. So again, we know that this is not bilaterally symmetrical. The mandibular second premolar, it has three cusps. The distal cusp is smaller and the mesiolingual cusp is larger, isn't it? So again, you can easily differentiate whether which one is mesial, which one is distal. In case of maxillary second premolar, though its surface appears to be quite wrinkled, isn't it? It has so many grooves. Yet this is the most bilaterally symmetrical premolar. Most bilaterally symmetrical premolar, right? So this is the most symmetrical tooth. Not the tooth, sorry, it is the most symmetrical premolar, right? So let's go to the next feature, the triangular and the transverse ridges. So what are the triangular ridges and what are the transverse ridges? Whenever you have a cusp, right? So cusp is almost a triangular feature. So on the either side of the cusp, you will have a triangular slope. So let's say this is the cusp, isn't it? This is the cusp. So descending from the cusp is a ridge towards the occlusal surface. Let's say this is a ridge descending towards the occlusal surface. So on the either side of this ridge, you will have these spaces which appear to be almost triangular on a cusp, and that's why this ridge is known as triangular ridge. So each cusp has a single triangular ridge. So buccal cusp has one triangular ridge and the lingual cusp has one triangular ridge. And when these triangular ridge of the opposing cusps, they meet, then it forms a single transverse ridge. So buccal triangular ridge plus lingual triangular ridge equals to transverse ridge, right? So a transverse ridge is made up of two triangular ridges, one buccal and one lingual, right? So when the triangular ridges meet in the center, they form a transverse ridge. Now sometimes they might ask you which tooth has most prominent transverse ridge or which tooth has most prominent triangular ridge. Which of these teeth will have least prominent or non-existent transverse ridge or triangular ridge? That is one and the same thing, right? So usually they'll ask you about the most prominent transverse or triangular ridges. So let me show you a diagram that we have already studied before. So let's take a look at this diagram. So when you look at this diagram, do you see a very prominent feature on the occlusal surface which is not seen on any of these? So in none of these three teeth, a prominent feature is seen as it is seen in this mandibular first premolar. Now, what is this prominent elevation that is seen on the mandibular first premolar occlusal surface? This is the triangular ridge of the buccal cusp, right? The shaded area, this is the triangular ridge of the buccal cusp. So, you can have an idea of how prominent this triangular ridge on the mandibular first premolar is, isn't it? So, you can say amongst all the permanent teeth, in all permanent teeth, mandibular first premolar has most prominent triangular ridge. And which is this triangular ridge? It is the buccal triangular ridge. Obviously, the lingual cusp itself is insignificant. It is non-functional. So, this prominent triangular ridge has to be the buccal triangular ridge. So, be it triangular ridge or be it transverse ridge, either triangular or transverse, for both you will answer mandibular first premolar, right? For both you will choose mandibular first premolar. Mandibular first premolar has the most transverse ridge, most prominent transverse ridge or most prominent triangular ridge amongst all the permanent teeth. In case of deciduous, just for the sake of comparison, I am telling you it here that in primary teeth, the most prominent triangular or transverse ridge is seen in mandibular first molar, right? It is seen in mandibular deciduous first molar, and even the most prominent marginal ridge is seen in deciduous mandibular first molar. So we'll come to it later on when we are studying the molars, right? So right now let's compare the premolars. So the most prominent transverse ridge or the triangular ridge is seen in mandibular first premolar. Mandibular second premolar has a less prominent triangular or transverse ridge. The maxillary premolars, they have almost non-existent triangular or transverse ridges. So the least prominent triangular ridges or transverse ridges would be seen on maxillary premolars and more prominent in the mandibular premolars. Amongst those, it is the first premolar which has most prominent triangular or transverse ridge. I hope I am clear. If you have any doubt, do ask me, right? So next, let's go to the central groove. So sometimes questions on the central grooves are also asked about the length of the central groove, the shape of the central groove, presence or absence of central groove. So as you can see in the first premolar, maxillary first premolar, we will just talk about the central groove. It is defined as, or it is described as being long. In the second premolar, it is described as being short. It is straight. In both of these, it is straight, right? And it is described as either short or long. In case of mandibular first premolar, it is absent. So the central groove is absent in mandibular first premolar, and in maxillary first premolar, it might have three shapes, right? If it is a two-cusp tooth, if it is a two-cusp tooth with prominent features, then the central groove is defined as H-shaped, right? If the features are a bit rounded and it is yet a two-cusped tooth, then it might have a U shape. As in this diagram, if it has three cusps, then it will have a Y shape. So these are the three shapes of the central groove that are seen in the mandibular second premolar. So amongst these, if I ask you which is the most common, your answer would be Y, isn't it? Because usually this tooth presents as a three-cusped anatomy, right? So the Y central groove would be most common. The central groove is absent in which of the premolars? It would be mandibular first premolar, and amongst the maxillary premolars, it is longer in the first premolar and it is shorter in the second premolar, right? Next, accessory grooves or supplemental grooves. Central groove is the developmental groove. Now, supplemental grooves. right? Supplemental groups. I have already told you about the mesial marginal group, which is a developmental group, and I have also told you about the mesiolingual group, which again is a developmental group. So we will not talk about these groups again, right? So where are the supplemental groups seen? Maximum supplemental groups are seen on mandibular second premolars, right? Maximum developmental groups. I'm sorry. Maxillary second premolar. Maximum developmental groups amongst the premolars are seen on maxillary second premolar, then on the mandibular second premolar. So these two teeth usually present with maximum numbers of supplemental group. Because of the presence of supplemental groups, the maxillary second premolar is often described as having wrinkled occlusal surface, right? So it is often described as having a wrinkled occlusal surface. So that is all about the developmental and supplemental groups. One more thing that I'd like to tell you is about these pits, mesial and distal pits. Do you see these radiating supplemental groups and the mesial and distal pits, right? Because of this, the premolars occlusal anatomy, the mandibular first premolars occlusal anatomy, it presents as a typical shape, and this is often described as snake eyes appearance. So it appears like the eyes of a snake, as if it's a hooded snake, and these two pits and the supplemental groups, they appear like the eyes of a snake. So snake eye appearance, if someone asks you which tooth's occlusal surface shows the snake eye appearance, it would be mandibular first premolar, right? It would be mandibular first premolar. Though it lacks central groove, yet it has the pits, mesial and distal pits, and because of that, its appearance, the appearance of the occlusal surface, it typically appears like the eyes of a snake. Next, let's go to the roots. So in case of roots, usually the premolars, they are single rooted teeth, isn't it? Except maxillary first premolar. So maxillary first premolar has two roots, a buccal and a lingual root. Apart from that, all the other premolars, they are single rooted, isn't it? All the other premolars, they are single rooted. So as you can see here, the crown on the maxilla, the crown on the maxillary premolars, it appears to be straight on the root, but in case of mandibular premolars, the crown appears to be slightly bent, isn't it? The crown appears to be slightly bent. So can someone tell me what is the angulation of this tilt of the crown? What is the angulation of the tilt of this crown? It is maximum in the mandibular first premolar and it is somewhere around 30 degrees, right? So the bend of the crown is 30 degrees in mandibular first premolar. The second premolar is almost straight. So we don't talk about its angulation, but sometimes they might ask you the angulation of mandibular first premolar and is approximately 30 degrees to the long axis. Another favorite question used to be about the roots or canals. These days, I don't know if they have asked about these or not, because I haven't seen many questions on these. So usually, they'll ask you questions like which of the following teeth have the largest chance or have the maximum chances of a bifurcated root, or have the maximum chances of a bifurcated canal, or which of these teeth will have two canals, or which of these teeth will have two roots, right? So usually what they'll do, they'll take one premolar, one anterior, maybe a molar, right? So that's how they jumble up the options and they'll present it to you. So if you know this data, if you know which teeth usually have a bifurcated root or will have a bifurcated canal, then you can better compare it, right? So in case of premolars, the maxillary first premolar, as I've told you, it is a two-rooted tooth. Though only in 46% cases it has two roots, in approximately 50% cases it has a single root. Yet we call it a two-rooted teeth, a two-rooted tooth, right? We call it a two-rooted tooth. So we don't keep it in the category of the single-rooted teeth, right? All these teeth, the remaining three premolars, these are single-rooted. These are single-rooted. As you can see, in case of mandibular maxillary first premolar, it is usually two canals. It usually has two canals. It usually has bifurcated canals, right? 75.8% cases में दो canals होती हैं इसके अंदर. Clear? So it is considered as a bifurcated. It is considered as a two-rooted tooth. All the others are single-rooted. Yet you would notice that the maxillary second premolar has maximum chances of a bifurcated root. Similarly, the maxillary second premolar has the maximum chances of a bifurcated canal as well. So if such a question is asked to you, which of the following single-rooted tooth will have maximum chances of a bifurcated canal or a maximum chance of bifurcated root? Answer in each case would be maxillary second premolar if all the options are premolars, right? So if you have options like maxillary first premolar, second premolar, mandibular first premolar, second premolar, and which of these single-rooted tooth will have maximum chance of a bifurcated root or bifurcated canal, the answer would be maxillary second premolar, because the maxillary first premolar is a two-rooted tooth. It is not a single-rooted tooth. So within the question, we have excluded this tooth when we say that which of these single-rooted tooth. So at that moment, we have excluded the maxillary first premolar. So instead, if the question is which of the following teeth has maximum chances of a bifurcated canal or a bifurcated root, then your answer would be maxillary first premolar, right? So based on the question, you will choose your answer based on the question and the options. So next, let's go to the mesiodistal and faciolingual inclination. So as I have just told you that the crown is tilted on the root. Similarly, the entire tooth might be mesiodistally tilted or it might be faciolingually tilted, isn't it? So first is mesiodistal angulation. So mesiodistal angulation of the tooth in the arch. Mesiodistal angulation of the tooth in the arch. So as you can see, these teeth are not kept in the specific sequence, isn't it? Rather, they appear to be arranged randomly, isn't it? But actually, they are arranged according to their increasing angulation, right? So the maxillary second and the mandibular first premolar, these have least mesiodistal angulations in their respective arches, right? तो हम प्रीमोलर्स की बात कर रहे हैं, हम एंटीरियर्स की और किसी की बात नहीं कर रहे हैं. अगर हम mesiodistally most upright teeth देखने जाएं तो mesiodistally most upright would be mandibular incisors and most tilted would be maxillary canine, right? So maximum angulation would be that of maxillary canine and minimum angulation would be that of mandibular incisors. But in case of premolars, maxillary second and mandibular first premolar, they have lesser angulation as compared to the mandibular second and maxillary first. Similarly, faciolingual inclination, that is buccolingual inclination, that is again minimum for maxillary first premolar, right? So mesiodistal inclination was minimum for maxillary second premolar and faciolingual inclination is minimum for maxillary first premolar. Is it clear? So maximum faciolingual inclination would be that of maxillary central incisor. It has maximum faciolingual inclination, approximately 28 degrees, right? Approximately 28 degrees. So it has maximum faciolingual inclination. As we move posteriorly, the faciolingual inclination decreases till we reach the premolars. Again, it increases in the molars, right? Again, it increases in the molars. So this was about the faciolingual and mesiodistal inclination. So sometimes what will happen is faciolingual inclination of mandibular first premolar is 9 degrees. Yet it has the most angulated crown. So these are two different things. Crown angulation and tooth angulation. So crown angulation and tooth angulation. So crown angulation is 30 degrees, whereas tooth angulation is just 9 degrees, right? So the entire tooth is at an angle of 9 degrees, but on the crown, on the root, the crown is bent by 30 degrees, right? So next is developmental depressions on the root. So as I told you yesterday, some teeth will have a deeper or a more prominent mesial developmental depression. Some will have prominent distal developmental depression. Maxillary anteriors, for example, they had a more prominent maxillary incisors, for example, they had a more prominent mesial, isn't it? Mesial developmental depression. But in case of premolars, they will usually have a prominent distal developmental depression. So as you can see, 3 of these premolars, they have a prominent distal developmental depression, isn't it? And it is just the maxillary first premolar which has a mesial depression which is more prominent as compared to the distal developmental depression, right? We have already studied that there is a mesial marginal groove which continues on to the mesial crown depression, which then continues on to the mesial developmental depression on root. तो ये सिंपल सा है, राइट? डेवलपमेंटल डिप्रेशन कहाँ पर ज्यादा है? maxillary first premolar and mesial side, rest all the premolars on the distal side, right? So next is about dimensions. So just like yesterday, crown length, root length, mesiodistal and facial-lingual dimensions. So premolars more or less they have similar dimensions, right? They have similar dimensions. So when the crown length is concerned, all the premolars have same crown length, right? They have same crown length except mandibular second premolar. So mandibular second premolar has the least crown length. So crown length least किसकी है? सबसे कम किसकी crown length होगी? Mandibular second premolar की. And how much is it? It is 8 millimeters. And fractionally, the maxillary first premolar is longer as compared to the others. So longest crown amongst the premolars would be that of maxillary first, and smallest would be that of mandibular second, right? Then the mesiodistal dimension. As far as the mesiodistal dimension is concerned, all the premolars they have same dimension, right? All the premolars they have same dimension, 7 millimeters. Yet the mandibular second premolar might be marginally broader as compared to the other premolars, since it has 2 lingual cusps, right? So it might be slightly broader as compared to the other premolars. Then next is the buccolingual dimension. Buccolingual means the thickness of the crown. So buccolingual thickness of the crown maximum would be that of maxillary first premolar, right? So maxillary first premolar has maximum thickness. Same would be for the maxillary second premolar. Least is for mandibular first premolar, and mandibular second premolar has approximately 8 millimeters of thickness, right? So minimum thickness तो किसकी होगी? Buccolingual thickness, mandibular first premolar की और mandibular first premolar की और maximum maxillary first premolar की. Root length again would be same for all the premolars, right? It would be same for all the premolars except the mandibular second premolar. So mandibular second premolar has the longest root, and maxillary first premolar has the longest crown. Is it clear? So longest crown, maxillary first premolar, longest root, mandibular second premolar. So this was about the dimensions. Now let's go to some MCQs. तो MCQ सॉल्व करते हैं. अगर किसी को कोई भी डाउट हो तो आप मुझसे पूछ सकते हो, right? So which of the following premolars most commonly has 2 roots? Which of the following premolars most commonly has 2 roots? Now, so the question does not specify whether it is a single rooted tooth or a double rooted tooth, isn't it? So we'll consider all the 4 premolars. We haven't yet ruled out any premolar. So we already know that the maximum chances of 2 roots are in the maxillary first premolar, isn't it? अभी हमने डिस्कस किया है. तो maxillary first premolar, that is option C, is the correct answer, because maxillary first premolar almost 46% cases में 2 roots होती है उसमें, right? Is it clear? Do you have any doubts? So next question, the occlusal outline of mandibular first premolar is best described as. So mandibular first premolar, as we just discussed, it resembles the maxillary canine, and therefore its outline is described as diamond shaped, isn't it? Diamond shaped. Which premolar exhibits a Y-shaped occlusal groove pattern? तो हमने डिस्कस किया था कि mandibular second premolar, it has three types of occlusal groove pattern or central groove pattern. Occlusal groove or central groove, it's one and the same thing. Either it's Y or H or U-shaped. So Y pattern would be seen in mandibular second premolar, which has three cusps, right? So option B. Which premolar commonly? Very good. Y shape, it is mandibular second premolar. So option B, right? Fourth, which premolar commonly has a non-functional cusp? Which premolar commonly has a non-functional cusp? So we have discussed it, isn't it? Which premolar has the smallest lingual cusp or a lingual cusp that resembles the cingulum? So that is the same tooth, isn't it? That is the same tooth. So which premolar has a non-functional lingual cusp? It would be mandibular first premolar, isn't it? Mandibular first premolar. आप लोग भी पार्टिसिपेट कर सकते हैं. ट्राई टू पार्टिसिपेट, ट्राई टू आंसर. गलत हो सही हो कोई बात नहीं, है ना. जस्ट ट्राई टू आंसर. So which premolar commonly has non-functional lingual cusp? It is the mandibular first premolar. Which premolar? The premolar with the most prominent transverse ridges. अब इस क्वेश्चन का आंसर करने की कोशिश करो, right? The premolar with most prominent transverse ridge is. So which premolar has the most prominent transverse ridge? Again we have discussed it. The triangular ridge, the transverse ridge, most prominent, they are in the same tooth, isn't it? They are in the same tooth. तो किस टूथ में है most prominent transverse ridge या triangular ridge? Is it maxillary first? Is it mandibular first premolar? Is it maxillary second premolar? Or is it mandibular second premolar? क्या आंसर होगा इसका? So the correct answer here would be option B, isn't it? Mandibular first premolar. So mandibular first premolar, it has the smallest lingual cusp, yet it has the largest triangular or transverse ridge, and it is located on the buccal cusp, isn't it? So buccal बेटा डेंटल एनाटॉमी के लिए भी एक्चुअली पल्स अच्छी है. गौरी शंकर भी एक किताब आती है, आप गौरी शंकर को भी कंसल्ट कर सकते हैं, ठीक है. दो देयर आर सम मिस्टेक्स इन गौरी शंकर, तो उसके लिए आपको थोड़ा सा ध्यान देना होगा. अदरवाइज गौरी शंकर इज ऑल्सो अ गुड बुक, आप वहां से भी देख सकते हैं, ठीक है. तो mandibular first premolar has the most prominent triangular ridge. In fact, it makes up approximately 80% of the transverse ridge, right? It makes up approximately 80% of the transverse ridge. Which of the following premolars often has a mesial marginal ridge that slopes cervically? So as I've told you, in the premolars, the marginal ridges are perpendicular to the long axis, except in one of the premolars where it slopes at an angle of 45 degrees, just like the anteriors, right? This is an exceptional tooth. Which tooth is this? कौन सा दांत है ये? Maxillary first premolar, mandibular first premolar, maxillary second, or mandibular second. So which of these is the correct answer? It is again the mandibular first premolar, right? Mandibular first premolar. So next question, which premolar is most likely to have two canals even with a single root? It's B, beta. It's not D. It's B. Yeah. Yes. Which premolar is most likely to have two canals even with a single root? Right. So now, when they say even with a single root, it does not mean that they are talking about a single rooted premolar or a bifurcated premolar or a two rooted premolar. We need to focus on the wording. So even if the tooth has a single root, the canals are more commonly bifurcated. So as I've said, the first premolar in 46% cases is two rooted, and in 52% cases is one root. It has one root, isn't it? So even if it has a single root, the chances of two canals are maximum in the first premolar. So that's why we need to read the question carefully. अगर यहाँ even नहीं होता, अगर ऐसे होता है ये question, which single rooted premolar is most likely to have two canals. अगर ये क्वेश्चन इस तरीके से होता है, which single rooted tooth, which single rooted premolar is most likely to have two canals, then the answer would be maxillary second premolar. ठीक है, तो सिंगल रूटेड प्रीमोलर के बारे में नहीं पूछा है, यहाँ क्या पूछा है, कोई सा भी प्रीमोलर उसकी एक रूट भी है तो भी सबसे ज्यादा उसमें सेकेंड कैनाल्स के चांसेस हैं. सो दिस लैंग्वेज अगेन इंक्लूड्स maxillary first premolar, right? It does not exclude the maxillary first premolar. तो यहाँ पर आंसर क्या हो जाएगा, maxillary first premolar, right? तो हमें क्वेश्चन की लैंग्वेज को ध्यान से पढ़ना है. अगर हमने क्वेश्चन को ध्यान से पढ़ा तो हमारा जो क्वेश्चन है वो काफी हद तक आसान हो जाएगा, आंसर करना बहुत आसान हो जाएगा. अगर क्वेश्चन ही हमने ढंग से नहीं पढ़ा, अगर हमने सिर्फ इस बात पे कंसंट्रेट किया कि ये सिंगल रूट पूछ रहा है, तो हम गलत आंसर दे सकते हैं, राइट? तो उस तरीके से पेपर थोड़ा डिफिकल्ट हो जाता है. तो पेपर डिफिकल्ट होगा, इजी होगा, काफी हद तक ये इस बात पे भी डिपेंड करता है कि हमने क्वेश्चन को कितने अच्छे से पढ़ा है, कितने अच्छे से समझा है, राइट? So next question, which of the following has a buccal cusp much longer than the lingual cusp? ये भी हमने डिस्कस किया है. एक प्रीमोलर ऐसा है जिसमें बक्कल और लिंगुअल कस्प ऑलमोस्ट सेम साइज के हैं. दूसरा ऐसा है जिसमें बक्कल और लिंगुअल कस्प में बहुत ज्यादा डिफरेंस है. Even the lingual cusp, it appears rudimentary or non-functional or like a cingulum, isn't it? So which is that tooth? Is it maxillary second premolar or maxillary first premolar, or is it mandibular first premolar or mandibular second premolar? तो इनमें से कौन सा वाला है वो? It is the mandibular first premolar. So as you can see, most of the questions are centered around this mandibular first premolar. इतना exceptional tooth है ये. मार्जिनल रिज ले लो, कस्प ले लो, कुछ भी फीचर उठा लो, कहीं ना कहीं कुछ ना कुछ एक्सेप्शन मैंडिबुलर फर्स्ट प्रीमोलर में मिल ही जाता है, राइट? The lingual inclination of the crown is a distinguishing feature of. So lingual inclination of the crown, again we have studied this feature, right? मैंने आपको बताया था कि facial-lingual inclination is 9 degrees, but the crown inclination is approximately 30 degrees, which is maximum amongst any tooth, isn't it? तो ये कौन से tooth का feature है जिसमें crown का inclination 30 degrees है, but the entire tooth has an inclination of just 9 degrees, right? तो mandibular premolars का है या maxillary premolars का है, all premolars maxillary. So actually it is not asking about a single tooth, it is asking about a group of teeth in general. तो क्राउन इंक्लिनेशन किसका फीचर होगा, मैंडिबुलर प्रीमोलर्स का या मैक्सिलरी प्रीमोलर्स का, या दोनों ही प्रीमोलर्स में क्राउन इंक्लिनेशन मिलेगा? तो जैसा कि हमने ये भी चीज देखी है कि मैंडिबुलर प्रीमोलर्स में क्राउन इंक्लिनेशन होता है, सेकंड प्रीमोलर में बहुत कम है, बट फर्स्ट प्रीमोलर में अप्रोक्सीमेटली 30 डिग्रीज है, राइट? सो इसका सही आंसर क्या हो गया, ऑप्शन ए, दैट इज मैंडिबुलर प्रीमोलर्स, राइट? Which premolar most closely resembles a molar in its occlusal anatomy? अब molar को कौन सा premolar resemble कर रहा है? Usually all the premolars they will have a two cusp anatomy, isn't it? Except for the mandibular second premolar, and mandibular second premolar has a three cusp anatomy, isn't it? It has a three cusp anatomy, Y-shaped central groove होता है और three cusp anatomy होती है इसकी. तो molar को most commonly जो occlusal anatomy रिजेंबल करेगी वो होगी सेकेंड प्रीमोलर थ्री कस्प टाइप की, राइट? थ्री कस्प टाइप मैंडिबुलर सेकेंड प्रीमोलर. सो दिस वुड क्लोजली रिजेंबल दैट ऑफ द मोलर एनाटॉमी, राइट? अगर हम शेप की बात करें तो ये इसकी ओक्लूजल शेप कैसी है, स्क्वायर। और मोलर्स की भी अगर हम बात करें तो इट इज आइदर रोम्बॉइड और स्क्वायर और रेक्टेंगुलर, समथिंग लाइक दैट, राइट। तो नेक्स्ट क्वेश्चन पे चलते हैं। Which of the following is least likely to have a central groove? तो amongst all the four premolars हमने डिस्क्राइब किया था सेंट्रल ग्रूव। अपर 4 में कैसा था, लॉन्ग, अपर 5 में शॉर्ट, लोअर 5 we had 3 shapes and lower 4 it was absent. So usually the central groove is absent in the lower 4, that is the mandibular first premolar, isn't it? It is usually absent in mandibular first premolar. So next question, which of the following premolars has cusps with almost equal length? तो अभी हम थोड़ी देर पहले क्वेश्चन सॉल्व किया था जहां पर डिफरेंस मैक्सिमम पूछा था, अब मिनिमम डिफरेंस मतलब बक्कल और लिंगुअल कस्प दे आर ऑफ ऑलमोस्ट इक्वल साइज। तो ये फीचर किसमें था, अपर 4, अपर 5, लोअर 4, लोअर 5, इनमें से किसमें ये फीचर हमने देखा है कि जहां पर कस्प जो है बक्कल और लिंगुअल दे हैव ऑलमोस्ट इक्वल gingivo-occlusal length, they have almost equal cervico-occlusal length. इसमें था ये फीचर maxillary second premolar, right? So maxillary second premolar has almost equal sized cusps, isn't it? तब हमने ये भी बात की थी maxillary second premolar जो है almost symmetrical है, isn't it? Bilaterally symmetrical tooth amongst all the premolars यही है। So which premolar is the first to erupt in permanent dentition? तो ये एक eruption में से है। Cupids means anterior teeth up to the canine. Cupids वो जब अपन हंसते हैं तो हमारी जो lip है, it is supported by the canines, isn't it? Sometimes it is also called the cornerstone, क्योंकि वो हमारी जो smile है उसका जो एक curve है उसको form करने में help करता है canines. So the cupid, basically these teeth, anterior teeth, which support the smile, right? So smile को support करने के लिए one of the most important tooth is canine, and that's why it is often also known as cornerstone. तो cupid के साथ आप cornerstone भी add कर सकते हो canines के लिए। I hope आपका डाउट क्लियर हुआ dental bud। Which premolar is the first to erupt in permanent dentition? तो ये हमने जब chronology हम पढ़ रहे थे तब हमने पढ़ा था all the mandibular teeth they erupt before their maxillary counterparts except the premolars. Premolars में maxillary premolars they erupt before the mandibular counterparts. So upper 4 erupts before lower 4, then upper 5, and then at last lower 5. So this is the sequence, isn't it? So which premolar erupts first? It is the maxillary first premolar, isn't it? Maxillary first premolar would erupt first. Which of the following has a central pit in the occlusal surface? So what is a pit and when is a pit formed? A pit would form when the grooves cross each other, right? Developmental grooves. So when the developmental grooves cross each other, their crossing is described as a pit, right? Their crossing is described as a pit. Now in case of mandibular second premolar, we have grooves crossing, isn't it? We have the grooves crossing in the 3 cusp type. This is the lingual groove, this is the central groove, isn't it? This is the central groove. So a pit would be seen here. A pit would be seen here at this junction of the grooves. So this pit on the occlusal surface in a premolar would be seen in mandibular second premolar, which has a 3 cusp anatomy, isn't it? Which has a 3 cusp anatomy. Is it clear? So next question. Which premolar shows the most variation in number of cusps? So ये तो हम कई बार पढ़ चुके हैं ना, सारे ही प्रीमोलर्स में 2 cusps हैं एक्सेप्ट मैंडिबुलर सेकेंड प्रीमोलर में, जिसमें कभी कभी 2 और कभी 3 cusp देखने को मिलते हैं। तो cusp नंबर में वेरिएशन कहाँ पर दिखेगी हमें? मैंडिबुलर सेकेंड प्रीमोलर में। बाकी सब में तो 2 ही cusp हैं, केवल मैंडिबुलर सेकेंड प्रीमोलर है जिसमें 3 cusp भी होते हैं और 2 cusp भी होते हैं। तो मैंडिबुलर सेकेंड प्रीमोलर, राइट। अब लास्ट क्वेश्चन इज विच सिंगल रूटेड प्रीमोलर मोस्ट कॉमनली हैज अ बाइफरकेटेड रूट। तो अब हमने सेम चीज के ऊपर 3 क्वेश्चंस देखे, इजंट इट। सबसे पहला क्वेश्चन तो क्या था कि विच ऑफ द फॉलोइंग टीथ विल कॉमनली हैव अ बाइफरकेटेड रूट। फिर दूसरा क्वेश्चन था विच ऑफ द टीथ इवन इफ इट हैज सिंगल रूट will is most likely to have a bifurcated canal। और तीसरा क्वेश्चन क्या है, विच सिंगल रूटेड प्रीमोलर। तो यहाँ पर जब हमने सिंगल रूटेड प्रीमोलर कहा, हमने उसी वक्त मैक्सिलरी फर्स्ट प्रीमोलर को रूल आउट कर दिया, राइट। हमने इसी जगह पर मैक्सिलरी फर्स्ट प्रीमोलर को रूल आउट कर दिया। तो अब हमारी चॉइसेस क्या है, बी, सी और डी में से हमें चूज करना है, राइट। और जैसा कि हमने टेबल में देखा, मैक्सिमम चांसेस ऑफ अ बाइफरकेटेड रूट और अ बाइफरकेटेड कैनाल is in maxillary second premolar। So आपका ऑप्शन सी यानी maxillary second premolar is the correct answer, right। तो ये लास्ट क्वेश्चन था। क्या अभी कोई डाउट है, कुछ पूछना है? You can ask me if you have any doubts। अगर कोई डाउट है तो आप पूछ सकते हो, प्रीमोलर से रिलेटेड कोई और डाउट हो, या पिछली हमारी क्लास से रिलेटेड कोई और डाउट हो, या वैसे ही कोई और डाउट हो पढ़ाई से रिलेटेड या कुछ भी, यू कैन आस्क मी। तो अगर कोई डाउट नहीं है तो फिर हम दोबारा मिलेंगे नेक्स्ट क्लास में। अंटिल देन स्टडी वेल। कोई भी डाउट आए पोस्ट करो, पूछो, ठीक है। ऑल द